First, what is the meaning of the word anatomy? It's a Greek word. Have you ever asked yourself, what does anatomy mean? We break it up. It's Greek. And ana deals with up. And tomi is from tim, nien, just to give the Greek word. It's not the same, but that's what it comes from. And that just means to dissect. So essentially, one is going to dissect the body to see the various parts. But you'll find that looking at terminology and finding the derivation can be fun. So, terminology, derivation, it helps you remember. So we're going to just take 6 words. Let's take artery. Everybody's heard of an artery. What does your artery do for you? Carries oxygenated blood, right? But in Latin, what does artery mean? It means air holder. Air holder. Why? Because with the last contraction of the heart, the blood goes out through all the arteries, so the cadaver has no blood in the arteries. So the early individuals looked at this and said, well, it must hold air. Interesting. Makes an artery dynamic for you when you see an empty artery in a cadaver. So in Latin, artery means air holder. Let's take another word. Genitals. Genitals. You can figure that one out. Genitals. Where did that name come from? From Genesis. What does Genesis mean? Birth. Let's take another one. Just want to make it fun when you look at words and try to figure out how they came about. They only had dead bodies to look at to see blood flow or anything in those days. What's another one? Let's take carotid. What's a carotid? Does anybody know? The arteries in your neck taking the blood to your brain, the carotid arteries in neck take blood to brain. So what's carotid mean? It means stupor. Stupor. So if you press on your carotids, you reduce the blood flow to your brain and you go into a stupor, right? So never take your pulse from your carotid arteries. Take it from your radial artery here. You don't cut the brain supply, right? But that's fun of carotid. Let's take the uterus. What does uterus mean? How many here have a uterus? How many have ever asked, what does the word uterus mean? Uterus? Uterus means hysteria. That's what the early anatomists thought. Isn't that fascinating? How far we've come? hysteria means excess anxiety, right? So much for that. What's the uterus do, really? Do you think it causes you all that excess anxiety? Or do you think it houses the growing individual, right? It's where the baby grows. Baby develops. Let's try another one. We said we had 6. Let's try 5. Let's take femur. Most of you have heard of femur. What is the femur? It's the largest bone in your body. Where is it? It's your thigh bone, sure. So, femur means thigh. So you know immediately where it is. We'll study it in detail, but right now we're just seeing its derivation. And since we've taken one organ associated with reproduction from the female, let's take one from the male. Let's take the penis. What does penis mean? No guesses? You'll be really surprised. Tail. Sort of had their directions mixed, didn't they? Gives you something to think about. But I bet you won't find anybody at lunch who knows what penis means. All right, but the fun of learning terminology. Look it up if you don't know and want to know, because once you know, you never forget it. All right? Now, what kind of techniques do we use to study anatomy? As we've said, we use gross anatomy and we use histology. Techniques to study. Gross anatomy. And that is studying the body with the naked eye. And you'll learn we have lots of shorthand. In medical terms, a C with a line over it means width. Okay, we use it all the time, and we'll be using shorthand. So, gross anatomy with naked eye. With microscopic anatomy, we can study with a light microscope up to 1,000 times magnification. A light microscope. A 1,000 times mag. Or with an electron microscope, over 30,000 times magnification. And there are different kinds of electron microscopes to help study the body. We have what's called a transmission EM. We abbreviate electron microscope, just EM. So we have a transmission EM, where the electrons pass through the tissue. Electrons pass through tissue. And I write things on the board because it gives you a chance to think. If I just flash a slide up there, you have no time to put it in what we call your association cortex. So by the time you write it out, you can remember it. Then we have scanning EM. And scanning EM, in contrast, transmission EM is just TEM when you see that abbreviation. Scanning EM is SEM. And it just scans the surface of the tissue. It's beautiful. I'll show some pictures of your taste buds of scanning EM. Beautiful. Scans surface of tissue. So lots of equipment has been developed over the year to keep refining our approach to studying. And these techniques which I've mentioned here are all used with dead tissue. This is all dead tissue here. And with light EM, these are all dead tissue. But more recently, all of the technology has been dealing with living tissue. So we have what's called the nuclear magnetic resonance imaging with live tissue. An NMR, nuclear magnetic resonance. And that will give you the anatomy of your body. If they do the leg bones or skull, whatever, this is for anatomy. But then we can have what's called functional nuclear magnetic resonance. Functional. NMR. What is that then? It's combining the physiology and the anatomy. Physiology and anatomy, the function. And they can do that by picking up